Welcome to this explainer. Today we are diving straight into the fascinating, incredibly high-stakes world of pharmacology. We're going to examine exactly how medical professionals safely manage treatments. Medications are, of course, the vital substances we use to both treat and prevent diseases, and they play an absolutely essential role in modern medicine. But handling these powerful substances, that requires some serious, profound knowledge. Future and current healthcare pros have to possess a rigorous understanding of the main drug groups, dosages, administration methods, and the precise instructions for using them. So let's start with this crucial question. Think about it for a second. How do they actually guarantee the right medicine gets exactly where it needs to go? Because treating and preventing illness requires absolute, uncompromising precision. It is literally never just about scribbling a quick prescription and crossing your fingers. There's actually this complex, almost invisible architecture of safety protocols surrounding every single pill, drop, and injection. To make sense of all this, we're going to break the process down into 5 quick steps: the stakes, the blueprint, the delivery, the ultimate checklist, and finally, the handoff. All right, kicking things off with Section 1, the stakes, precision and patient safety. Healthcare workers are essentially walking a tightrope every single day, trying to find that perfect balance. On one side, you have overdosage. Giving a patient too much medicine doesn't just, speed up healing. It can actually cause toxic effects and lead to some really serious complications. But on the flip side, we have underdosage. Give too little and the treatment simply won't work, leaving the patient completely vulnerable to the disease. The dosage has to be exactly right. Because the stakes are this high, healthcare professionals cannot just guess. They have to strictly follow prescriptions and carefully calculate those doses based on 4 critical patient-specific factors. We're talking about their age, their weight, the specific diagnosis, and the actual severity of the disease. A dose that works perfectly fine for an adult might be completely toxic for a child or entirely useless for someone with a severe case of an illness.
Moving right along to Section 2, the blueprint. Classifying medicines.
So, the very first way we classify drugs is by their therapeutic effect, basically mapping each group to the specific clinical job it does. As you can see here, every group has a very specific mission. We've got analgesics, which are your typical painkillers. Then there are antibiotics for bacterial infections, and antivirals for, you guessed it, viral diseases. We also rely on antipyretics to bring down fevers, anti-inflammatories to decrease swelling, sedatives to calm a patient, and laxatives to help out with digestion. Memorizing this map is literally step 1 for any medical worker. The second way we categorize medicines focuses entirely on their physical form. We generally contrast common solid forms with a surprisingly massive variety of liquid options. Solids are the ones you're probably super familiar with: tablets, pills, and powders. But liquids? That category is much broader than you might think. It includes solutions, mixtures, drops, tinctures, infusions, and even decoctions. And to round out the physical forms, we have semisolids, think ointments and creams, and then the injectables, which usually come supplied in those little glass vials called ampules. Now, you might be wondering, why on earth do we need so many different forms? Well, the choice comes down entirely to the patient's condition and how fast the drug needs to act. A pill takes a while to digest, whereas an injection, that goes to work almost instantly.
Which brings us perfectly to Section 3, the delivery. Routes of administration.
How does the medicine actually enter the body? It turns out the specific clinical situation completely dictates the route. A doctor is usually going to choose the convenience of oral medication for long-term, ongoing treatment. It's just way easier for a patient to take a pill at home every morning, right? But if they absolutely need an immediate, rapid effect to stabilize someone, they're going straight for intravenous delivery, right into the vein. If you've ever watched a medical drama, you might have heard the term parenteral thrown around. It sounds incredibly technical, but it simply means bypassing the digestive system entirely. So whether you're administering a medicine intramuscularly into the muscle, intravenously into the vein, or subcutaneously right under the skin, you are using a parenteral route. Okay, let's jump into Section 4, the ultimate checklist, universally known as the 5 rights. This sequence right here is the ultimate, foolproof safety net in medicine. It's a rigorous mental checklist that every single nurse, doctor's assistant, and medical pro strictly runs through before giving any treatment. They have to ask, is this the right patient? Are we using the right drug? Is it the right dose, the right route, and is it the right time? I cannot stress this enough. Skipping even one of these steps compromises the entire safety of the procedure. And the safety protocol doesn't just magically stop once the medicine is in the patient's system. Meticulous, proper documentation of exactly what was given and when, alongside continuous patient monitoring, are absolutely mandatory. The medical staff has to keep a close eye out to ensure the treatment is not only safe, but that it's actually working the way it's supposed to.
Finally, we arrive at Section 5, the handoff, labels, and patient instructions. Now, when you go to the pharmacy to pick up your medicine, there's a fascinating and really commonly overlooked detail staring right at you: the color coding of the labels. Every medicine has a label with vital info, and the color itself is an immediate visual cue. White pharmaceutical labels specifically tell you that a drug is for internal use. Meanwhile, yellow labels, that is your bright warning sign that the drug is strictly for external use. It's just a brilliant, simple layer of safety.
Reading the specific instructions on those labels is incredibly important. You have to follow them if you actually want the medicine to work. Just think about these factors. Timing. Does it need to be taken before or after a meal? Preparation, having to physically shake a mixture before using it. And storage is massive. Suppositories need to be kept in a cool place, while things like ampules and drops are super sensitive to light and must be stored in the dark. The handoff of information from the doctor to the patient also includes critical warnings. Healthcare pros must clearly explain the possible side effects you need to watch out for. This could be something common, like a bit of nausea, or something severe, like an allergic reaction or other medical complications. Why is this upfront transparency so crucial? Because clear instructions directly prevent dangerous at-home errors and measurably improve your treatment outcomes. So, what is the ultimate takeaway here? Safe and effective medical practice doesn't just happen by accident. It relies entirely on this highly structured, uncompromising foundation of knowledge. From knowing if a drug is an analgesic or an antiviral, to choosing between an oral pill or an IV, to executing those 5 rights perfectly. These skills are fundamental. They are the true backbone of the daily work done by healthcare professionals everywhere.